Reporter Garrett Bergquist joins us from Sanford. Garrett, I see you're at a grocery store. What does the owner have to say about this bill and the potential?
Yeah, Tim, Greg Adams owns 2 grocery stores here in Lee County, including this one. He says he has about 85 employees in all. Adams says health insurance is far and away his biggest expense. Lawmakers right now are working on a bill that would allow so-called association health plans. That's where trade groups buy health plans on behalf of large groups of small businesses. The idea is to reduce the cost to individual business owners. Adams says this could reduce his costs by up to 30%. He says that's a life or death margin for some businesses.
There's some small businesses that they can't afford it. And what it does, it eliminates more small business. You know, the big guys that have big policies, you know, put them out of business, because all of a sudden when your rates double, triple, and quadruple, a lot of companies, they just no longer can be in business.
Now, this idea is not without its critics. The left-leaning Center on Budget and Policy Priorities says association health plans don't have the same oversight and cost controls that plans administered through the Affordable Care Act do. Now, sponsors of this legislation say it could expand health care coverage to up to an additional 110,000 North Carolinians.
Well, Garrett, as you know, there's the budget impasse going on. I mean, session is sort of winding down. Typically, it's even over by this point. So where are we in the process here with this?
Yeah, well, Tim, right now this bill is awaiting a floor vote in the House. Now, an earlier version already passed the Senate. This bill has been changed quite a bit. It's a compromise package between the 2 chambers. So if it passes the House, it would have to go back to the Senate, and the Senate would have to decide whether or not to accept the changes the House made.